On the surface, Nantucket is an island postcard, quiet, remote, and picturesque. But underneath the charm lies a rural community facing serious health challenges with limited infrastructure and few pathways to care.
We were informed of the RVEI grant opportunity in what I call high pandemic times, as we were starting to run into challenges with the kind of one-size-fits-all high-speed vaccination program.
With few vaccine options available on the island, the Nantucket Board of Health needed flexibility. The Rural VEI grant allowed them to act fast and creatively.
Once we first managed to secure the grant, we immediately looked at ways to deploy it to get more needles in arms as quickly as we possibly could.
They expanded contracts with the Visiting Nurse Association, added staff to the public health nursing team, and launched a series of mobile and school-based vaccine clinics across the island.
We learned very, very quickly that a big part of hesitance around vaccine access was not to do primarily with the vaccines themselves. It was a lack of trust between the agencies providing those vaccines and the people who needed them the most.
Trust wasn't built through mandates. It came through relationships. That meant home visits, cultural responsiveness, and providing information in ways that people could truly receive.
Using RVEI money to expand the amount of hours that our community health nurse could go and do health checks, which would then lead to vaccination opportunities delivered by someone who had already helped.
Local partnerships helped deepen that reach. Through collaboration with Our House, they found new ways to meet young people where they are, like vocational cooking classes and esports programming.
When we sent our public health nurse over there, we now are giving information directly to vaccine clinics so that people who we would never have seen in a vaccine clinic could make it in.
The project didn't just respond to the pandemic. It built something stronger, a new foundation for rural health on the island.
What I think really facilitates true collaboration, true lasting collaboration, is giving people tools to use that can help themselves and then allowing them to feed back into the greater system. And one thing that I can definitely say for certain is that most people are helped by helping others. And collaboration is fundamentally helping other people. Over the long run, these investments will return significantly more money in a healthier, wealthier, better educated rural community that can then go on to deliver better economic benefits than they could otherwise.
From memory cafes to mobile clinics, from teen partnerships to home-based care, the Nantucket Board of Health is redefining what rural health systems can look like. It's not about buildings, it's about trust, and it's about showing up. When rural communities are empowered to lead, they don't just recover, they thrive. That's the rural effect.